I think a great question, because that's probably the number one question I get from families. Are you sure it's safe? And you know, I vaccinated my whole family, and I'm very sure that it's a safe vaccine. But you know, we have ways to monitor this vaccine after it's out there, and we've been monitoring it this entire time. So,
not only do I believe in COVID vaccines, I believe in vaccines in general. The science behind vaccines in general is actually very sound.
So the mRNA vaccine is a little piece of mRNA that gets put into the body, but it does not, mRNA does not get incorporated into the cells, but it just borrows the machinery in your body to make a piece of the virus. So it's not the full virus, so you can't get COVID because it's only making a piece of it. It's like making the hair, right? It's not a full person, but it's enough to show it to the immune system and let it kind of know what it's up against and kind of build up immunity to that without actually causing the infection. And mRNA doesn't last very long, so once it's done its job, the body breaks it down and it's gone.
I feel like this is a little cliche, but I say to parents oftentimes, like, do you put the seatbelt on the baby when you get in the car every time? Or do you kind of say, not for this trip, I'm not gonna put the seatbelt on. And then you get a look like, no, I put the seatbelt on every time. Well, you don't get into a car accident every single time that you're out there, but you're putting the seatbelt on. So you're protecting your child, and you know that there's a chance that something bad could happen. So that's really analogous to what getting a vaccine can do. There's a chance that something bad can happen, and you don't want to have to say, I could have prevented or helped my child from this really bad situation if it were to come to that.